I'm always going to be reviewing your assignments. Sometimes there's a delay because I have other professional obligations and other obligations with the school itself. But even though there could be a delay of perhaps a week or so of all of them, and it really matters, it's really important that the assignments that you submit, you put some care into, and that you pay attention to what the directions are. So for example, initially, in the orientation for most students who are online right now, in the orientation, there was a document, an orientation document that I subsequently sent to you after your initial orientation session. And in most cases, there's some students who weren't a part of this, but in most cases, I also sent a video of the orientation. But to the point of what I'm speaking to right now, in that orientation, major components of that orientation, a key component of that orientation was referencing a textbook and some important references in your Fortney textbook that you need to make note of in order to be aware, okay, of what is involved in the assignments that you're doing, in order to have some sense of context with regard to the assignments that you're completing during the course of this externship. And as we get into more and more details related to the revenue cycle, understanding this within the context that you will be experiencing it in a professional setting is very important. So along those lines, as you can see on the screen here, one of the things that I pointed to was that it's important for you to use your Fortney's textbook, and that is the blue one. This is the workbook, but it's your blue Fortney's textbook, and specifically the pages that are referenced for you to look at are Chapter 4, Insurance Basics, where you should review Chapter 4 to just get an idea of what the basics of insurance billing are, to just remind yourself of that. And I noted page C65 for the reference to the revenue billing cycle. And you may remember that we went over that last week. So it's important. That's number one. The second thing is Chapter 14 in Fortney's. It has specific details on how to complete the CMS 1500. I noticed when I looked at some of the CMS 1500s that apparently some of you did not actually reference this chapter. So going forward, we're beginning in session 3, going forward, you do get credit if you've submitted the assignment. So you don't really have to be concerned about anything as long as you've submitted the assignment. I do grade the assignments, but you're graded on your attendance. So if you submit all of your assignments, and if each one of the drop boxes per week, if you have submitted something in there, you're going to get credit for attendance in every one of the drop boxes. But when I go in and I look at the details of what you have submitted, such as the details of how you've completed your CMS 1500, such as the details of how whether or not you completed all of the assignments and posting charges and payments, when I look at the details, I will give you a grade based on those details as time permits. My first point of focus with regard to the specifics about these details is the CMS 1500. And one of the things that I discovered when I looked at this, at some of the submissions for the CMS 1500 is that a lot of you really are not familiar with how to complete it. So that emphasizes even more the fact that when you're doing these going forward, use this chapter and these pages as for samples, okay, of how a CMS 1500 is supposed to be completed, and complete them according to that. All right, so I'd like to ask all of you who are in class right now, some of you are going to be looking at this on a recording, to take out your Fortney's insurance. I just want to show you something, because I don't think it's not always enough to talk about it, because you'll forget about it unless we put our hands on it and look at it. And I'd like for you to turn to page 300 of your Fortney's insurance. On page 300, what you will see is the beginning. As you can see here, the beginning of line by line and block by block instructions on how to submit how to complete your CMS 1500 form. So by a show of a thumbs up on the screen, I'd like a thumbs up for everybody who actually has their book. I know there's some of you who can't do this right now, but for those of you, when you get your book, thumbs up if you're on page. Thank you, Marjorie. You can do it a virtual thumbs up. I'm good with that. Thumbs up if you have your book with you and you're on page 300 of your book. And I need everybody to do this. For whom it is possible, I need everyone. I see your thumb, Alicia. Thank you. And Yadi Seth, are you there? Hi, Yadi Seth. Let me know if you need a tutoring session, because some of this may not be familiar to you. Okay, so I see enough thumbs up that I'm going to go ahead and proceed. Along these lines, it's really important that when you attend the review session that you are able to participate. Okay, I know it's a review session and some of you might have doctor's appointments scheduled, you might have things that you have to do, but you need to be able in this review session, because attendance is counted and you are getting attendance credit for being here, you need to be able to participate. And this is one of those instances where I know it's a surprise, but you got to participate because I want to make sure everybody gets this. So starting on page starting on page 300, as you can see, you have step-by-step, block-by-block instructions on what goes in these blocks. And for your reference, everything that you have to complete on the CMS 1500 is either referenced on the demographic sheet for the patient's part of it. And I'm going to pull it up. No, I won't pull it up right now because it's going to act slowly. It's referenced either in the demographics or it's referenced in the billing information that you submit on the patient. So you have all the information you need in most cases. Now, if you turn to page right now, starting on page 326 of your textbook, I want everybody to see this because I've talked about it before, but I don't think everybody heard me, and they may not have understood what the relevance of this is. So if you look at page 326 of your textbook, you can see that starting on page 326 of your textbook, you have examples of how to complete all kinds of CMS 1500s. You have an example of a private insurance company. You have an example of Medicaid on 327. On 328, you have Medicare with no secondary coverage. Some of these patients have more than one coverage. You have an example of a Medi claim or Medicare Medicaid claim on page 329, etc. You have Medigap, you have workers' compensation on page 334. So going forward, there should be no reason that you don't complete the CMS 1500 form. Yes, ma'am. Adriana.
I have my book online, and it goes from page 325, automatically goes to 335. I don't have the 10 pages in between.
Really? Okay.
Yeah,
Okay.
I'm trying to scroll, and it goes from 325 to 335. It doesn't give me those pages.
Thank you for bringing that to my attention. So I'm going to assist you. I have an electronic copy of this book, and I'm going to find those pages, and I'm going to print them I can't print all of them. I'm going to actually print maybe 3 of them, and I'm going to post them in the course.
And then for 330, it gives me, 300, it gives me do's and don'ts. It doesn't really give the step-by-steps. I'm not sure if that's the same page that you have.
No, it's, I'll find it for you.
Okay.
In the book that I have. So I'm making a note now to provide CMS samples and, here's my card. CMS 1500 samples and instructions. Okay? And this is important, and the reason it's important now, one of the reasons that it's important is because it gives you a familiarity with what's supposed to be on that form. And I understand that everybody didn't have the same teachers, and I get it, and everybody doesn't have the same experience. So I want to, in my role as a facilitator for an externship, which is meant to simulate or mirror a professional experience, I want to make sure that the things that I have observed that could be areas of weakness for students, I want to make sure that you have some familiarity with those and that you are aware of what they mean. Now, what I'm going to do is I'm going to give you info of some of the things that I found. And the only way that I'm going to be able to actually do this is by pulling up some work that I encountered. It doesn't, this is going to, if this is your work, you're going to recognize it. But it doesn't have your name on it. All right. So it's not that it's not, and it, besides, even if I use examples that may have your name on it or something like that, I would get permission about that, but it's not meant to embarrass you. It's only meant for you to learn. So some of the, let me find some examples here, some recent example of, let's see if this one will do. Yeah. Okay. This does not have a name on it, and this is not a lot different from what I encountered. So this example of a CMS 1500 that was completed manually by a student, what I want to focus on this particular example is something that I note that seems to be an area of misunderstanding on the part of many students, so I want to point it out now. And that is this section here. Now, one of the things to note, first of all, is you see the red line here, the broad red line in the middle of the form. Make a note mentally that everything at the top of this broad red line is related to the patient information. Okay, whether or not it's part of it was involved in an accident, etc. Insurance information, who referred, whether or not they have secondary insurance, and all of that. Who I have to ask, I'm checking in, I'm going to ask a check-in question. Who knows what signature on file means in box 12 and 13? What these two boxes mean?
They don't have to sign their signature on file.
Right. Is that Lizzie? I see a green.
Yeah.
Okay. Okay, Lizzie, right. It means that the signature is filed in their chart. But also, it also means that you have permission. In the first box, in box 12, you have permission to release information. Okay. About this claim only, and to be paid this one. Box 13 releases the payment to the doctor, and this box is always checked down here. But this part of the form is what I saw the greatest error, the greatest amount of errors. But it also revealed to me that some of you actually did get through your program, and you may not have a complete understanding, the understanding that you need in the field as professionals, about the difference between a diagnosis code and a procedural code. Okay, so I'm going to talk about that very briefly. Everything below this broad red line is going to be related to the provider of service in one form or another. In this box here, for example, box 17, there should be the name of if the documentation on your super bill says so, because sometimes it'll say referred by, not your super bill, but in your demographic sheet, for some of these demographic sheets. If your documentation on the demographic sheet indicates that the patient was referred by a doctor, you can put their name here, physician's name. And along with that, you put their NPI. We don't need to pay attention to this. And as a matter of fact, you can create a name if you like. It's not as important as what I'm about to show you. Here in box 21, where you have diagnosis or nature of illness or injury, can someone who can see this online, can you tell me one of the things that just jumps out at you about the codes that are placed on the CMS 1500 form here? Can you see something in box 21 that if you were a claims adjuster and you saw this, what would you notice first that could be wrong in box 21?
The procedure codes shouldn't be up there. Those are for diagnosis codes only.
Right. Exactly. So what, someone else?
They also didn't put the diagnosis pointer.
Yeah, that's something else, and that's exactly right. That was another major error. But in this case, it's really clear to me that this student does not understand the difference between a diagnosis code and a procedural code. Either that, or they may have just been putting something in there thinking that I'm not going to look, but this is something that I do look at. Some of them I just have to briefly look at to make sure you made a reasonable effort to complete the assignment. But the reason, sometimes when I give this assignments, in certain cases, students will question why it's necessary to complete a CMS 1500 when in reality, and this is the truth, in reality, when you're in the field and you submit all those steps that you submitted, that you're doing when you're submitting a claim like you're going to do this week, it's automatically created. And you don't have to do it. As long as you put the information in there and the information is accurate, the claim's automatically created. And in most cases, it's submitted electronically to the insurance company. So you are very, very rarely going to have to do this by manually. But this particular claim form demonstrates the reason I have you do them manually. All right? And the reason is to see whether or not you really understand what this form is about. Because you may get a claim rejection from an insurance company, and they will say, in this case, they'll say, let's see, inaccurate information in box 21 or something like that. Okay, you'll have to know what they're talking about. You can't look at this and not know that these are procedure codes and not diagnostic codes. They don't go there. Okay, the only thing that goes there in this box are these codes, and these are the codes that are on the super bill that are entered. These are diagnostic codes, and they go down here. Someone else pointed something out, but I heard your voice, but I don't know who you were when you mentioned that the diagnosis pointers are missing. Who was that?
That was me.
Hey, Gustavo. Thank you. And yes, the diagnosis pointers. So, and again, this is, and for you, I forgot the lady who told me she didn't have, was that you, Adriana? You're the one, okay. You'll see this when you see the samples. But for the diagnosis pointer, okay, whenever I'm going to take this out of here, I'm going to cut it, and I'm going to put it here in this box. And I'm going to cut this one out and put it where it belongs. And this one too. Okay? So we're going to kind of fix it. Everything, and it's not going to be fixed, but for all intents and purposes for actually demonstrating, we're going to pretend that the dates are on here. Okay? We're not going to take time for that, but for this procedure code 98941, you have the option, and I'm going to move this diagnosis because you can't really skip from A to E. You have two choices of diagnoses, A to B. And so what you're telling the insurance company when you submit a claim form like this is that you read some documentation, or there's some documentation in the patient record, and in that documentation, or on the super bill, these are the services that were provided, and these are the medical condition that these services were provided for. However, each one of these services do not necessarily relate to each one of these diagnoses. And by that I mean this first procedure code 97019 could only have been performed, possibly, I don't know all this by the diagnoses and procedures by heart, but let's say that this particular procedure code was only performed because of this diagnosis A. So you have to tell the insurance company that this procedure code relates to this diagnosis. Okay? Similarly, the second procedure code, it could be possible that this procedure code was for both of the diagnoses, A and B. Right? So this is what the relevancy of the diagnosis pointers are, and this is what should be in your designated in this spot going forward. All right? So what you have to do is you have to make a note when you see the super bill, you have to note what diagnosis, for example, and I'm going to go ahead and pull up the super bill for you to see so that you know what I am referring to. Let me go back to session, let's say session 3, because we're going to be doing super bill session 3. And I'm going to move this on over here so you can see what I'm doing. The files for session 3 are located in a folder. Files for completing the simulation playground activities, as usual, they're located in this folder. And I'm going to pull up a super bill. Okay? And when you, as most of you got this right, but going forward, I really want to see that you're thinking about this. And once I see you can think about it properly, and you know exactly, let me pull this up, pull it up. Come on up. Once I know you're thinking about it properly, we won't have to do this detail. But I feel responsible for educating you about things that I feel could be missing. So what you'll notice on the super bills that you have here is that there's a designation on the super bill for the related to the procedure code. In this one example that you're going to be doing this week, you have an office visit, and you also have an injection of iron that the patient gets for this visit. And let's see if there's anything else. No, there's not. And on as I demonstrated previously, next to the procedure code for what you're billing, it tells you, it gives a designation of what diagnoses that you're going to be billing for, diagnosis 1 and 2 here, and in this case, diagnosis 1 and 2. And these diagnoses are located at the bottom of the form. This is diagnosis 1. This patient has anemia, iron deficiency anemia, and they also have, let's see what the other one is that they have. They also have malaise, fatigue. Okay, so these are where your diagnoses are, and you are directed to those diagnoses at the top of the super bill where the procedure code is that you're entering. Now, related to that on the CMS 1500, let's go back to that. This is where you find these spaces. Diagnosis 1, for example, would be iron deficiency. This is not iron deficiency. This is a musculoskeletal injury. But for the diagnosis code for iron deficiency would go there, and the second one would be malaise. Okay? And in most cases, as you could see on that super bill that we just saw, both of these diagnoses, okay, were related to the office visit and to the injection. So that in this case, when you enter the office visit and the injection on the form, you're going to use A and B. Everybody understand? Anybody need any clarification on that? Okay, so from now on, this should make more sense. So there are 3 things that I talked about. One of them is the importance of you referencing your textbook for guidance. All right, it's assumed that because you got through the program, I'm assuming this just like a prospective employer would assume. This student has come to me with a diploma in medical billing and coding. And on top of it, they show me a portfolio, you know, sort of like a condensed form of your senior binder, some of the main things in your senior binder, because they're not going to want to look at everything in your senior binder, but they're going to look at some things, okay? And they show me a portfolio that indicates that they know a lot, right? So they expect you to know this. So just like I do. So but because some of these things are at a distance, or 6 or 7 or 8 months past what we're doing now, I'd like for you to remember to use your textbook as a reference to remind you of the right way to do things and to put things into context. Okay? Anybody have a question about what I've covered so far? Okay. I talked about the CMS 1500. Okay, good. So let's get on with what we're doing this week. Let me pull this one up. Pull the course up itself. And that sim chart. Let me get the course up. Sorry about that. Sorry about the delay. I'm going to pause recording right now. So this week you're going to be doing session 3. Now some of you that I know of, some of you actually started session 9. Thumbs up if you started with your first session for externship was session 9. So a lot of what we're doing now is like the baby step part of it for you. So you pretty much have this down, although there's some things that you do need to pay attention to. And among, as I mentioned before, among them is do not handwrite the CMS 1500 assignment. The other thing to distinguish is that the CMS 1500 assignment is separate from the one that you create in SimChart. Okay. But for you, those of you who actually had your first module or your first session in the externship as session 9, a lot of what we're doing is baby steps in practice, right? But for those of you who did not, and who, for example, started in session 1, this represents a progression from the beginning. So the beginning we did insurance verification. Session 2, we got a lot of practice at entering demographics. Now we're going to take it a little further in session 3, and we're going to advance our activity and we're going to advance our knowledge. All right. The main things that we're going to be doing in session 3 are, and let me just scroll down to this, or up to it. The main things that we're going to be doing in session 3 for new students only. So, and I'm speaking not to you if you're not new. If this is not your first session, I'm not speaking to you. But for those students who are listening to the recording and this is your first session, you're going to be learning how to do appointment scheduling, entering demographics and insurance information, completing a super bill, and submitting a claim form. The only thing that's missing from this related to the revenue cycle is posting payments. All right, so you're moving up in the world. It's important to make a note. This is a file for overview and instructions on how to create, how to print your assignments and put them in a Dropbox. And honestly speaking, it's somewhere you have to fast forward because there's a lot of talk on this to about the middle of this recording so that you can see the instructions in submitting your assignments. Always remember that when you start any of the sessions in the externship, it's important that the first thing you do is read the checklist. This guides you. It keeps you on track with what you have to do, step by step. Note that everything that you do that is an assignment anything for completing that assignment is always going to be each session located in files for completing simulation playground activities. And when we open this up, the first thing we see is the appointment schedule. Now for new students, the appointment schedule, and again for the follow-up students, it's not necessary for you to make appointments, but you will have to complete all the demographics on all the patients. For this session, Maple Hills Clinic, these are all the appointments and these are all the patients that you're going to be entering. These appointments are entered in the simulation playground. And I have a question, let's see, Yadi Seth, I have a question for you. Were you able to contact Elsevier and find out where the simulation playground is?
No, not really. I did get in contact with them, but they really weren't much help, to be honest.
Oh, no kidding?
Yeah,
I'm really surprised at that. They're usually pretty good.
I did go back on my class with Ms. G.
Uh-huh.
And Mr. Roy was there.
Good.
He said he was going to try and help, but that was on Tuesday or Wednesday.
Okay.
And then I checked back in yesterday, and my whole Moodle was still exactly the same. So I just
I'll help you.
I just did what I did.
Now, first of all, I usually have time to help, and I'm really surprised that Elsevier couldn't tell you. They didn't know what the simulation playground was.
Yeah, the person that was helping me, they were just like, oh, I really don't know what you're talking about.
Okay, so let me show you what we're doing. Okay, I'm going to pull it up for you, and I'm going to walk through the simulation playground so you know where to find it. And just so that you know, I'm not going to penalize you for any late assignments because you didn't know where this was. Now, I will point this out. This is something else that I was intending to point out. Most of the questions that I get are actually covered in the videos that I submit, most of them. And so if you try to backtrack and take a look at the video, I believe that I pointed out where the simulation playground is on the video. I'm almost sure I did on one of those videos. But in lieu of that, all the activities that you're going to be doing are involved in SimChart. And I'm going to pull up my SimChart down here. Mine is going to look different from yours because I use one that demonstrates. You would click on the SimChart course for your respective instructor, and or the course that you're still on the roster on. And once you enter into SimChart, okay, you would click SimChart for the medical office. And you know this part though, right, Yadi Seth? You know this part, right? Right, okay.
Yeah.
Okay. So I'm going to move a little faster now and show you where the simulation playground is. Did you get a chance to look at the video?
Yeah, but I think I was looking at the wrong ones because I was going back to session 1 and all of those.
Yeah.
So I think I was just getting mixed up.
Okay, no problem. No problem. Okay, so you click on simulation for the medical office in their simulation playground right there. Okay? Right up in the corner. Is that, you see it now? So this...
Yeah, I don't even think I have access to my sim charts anymore, to be honest.
Okay,
because I've
we're
never
going
seen
to when we
part of the sim chart before.
No, you don't usually go into this at all when you're doing the course.
Okay.
This isn't part of your normal course. This is a part of SimChart that allows students to practice with materials that are not pre-populated into the regular SimChart. These are your regular SimChart assignments. This does not relate to your regular SimChart assignments. So this is what I'd like for you to do. When we're done here, go to your SimChart course, click onto it, and you'll see this. It's in every one of them. Okay?
Okay.
So this is where you will do all the exercises in this course. You always, when you enter into the simulation playground, you always check return to previous session with save patient information, even if it's your first time, and then you start.
Okay.
Okay. All right. So now I'm going to move on. So back to what we're doing, and these are, and you have specific instructions that are step by step that involve each one of these processes. Some of the appointments are done in the front office. The clinical care, when you are actually creating an office visit for the patient, is done here. And coding and billing, when you're creating a super bill, or when you're doing things on the ledger and creating a super bill, posting charges to the ledger, creating a claim, are all done under coding and billing. All right. So let's go back to the course and let's look at what we're going to be doing this week for session 3. For session 3, here you just saw the list of materials that you have. As usual, I think the newest thing that you're going to do this week is actually going to be, let's see, creating the super bill and the claim form. What did you? Yeah, you really did demographics and insurance information last week, right? So this week, what's going to be added to it is the super bill and the claim form. Just like everything else, all of the assignments, step by step, are right here. Office visit in the simulation playground, super bill and claim form are all right here. And if you follow these steps, step by step, you shouldn't go wrong. I've never had an issue with students not being able to do anything if they follow these steps. Now, something to keep in mind with SimChart for the medical office is that you'll notice on the instructions that it will tell you to go to the front office. Okay? It will tell you from there that this is where you schedule all of these appointments that you see. Let's go back here. All these appointments are going to always be scheduled in the appointment in the front office. Okay? When under the instructions for creating an office visit, for the next step, creating an office visit in the simulation playground, these are always going to be under clinical care. So you click the clinical care tab and you look at, as long as it lets me there, okay, you pull up the patient, select the patient, and you follow the instructions. Okay, on the info panel. It's going to tell you to click one of these. Okay, usually office visit. Okay, and you're going to have the ability to add a new office visit. These are in the instructions. Again, if you look at the instructions step by step, you will have it. The other thing is that let's see. So we have office visit, super bill, and claim form. The same thing. The instructions are here for creating an office visit and a super bill and claim form. You would actually be directed to, let's go back here to the right tab, coding. And after you create the office visit, under the coding and billing tab is where you'll be able to click this to create the super bill and click here to create the claim. And if you follow the step-by-step instructions, you can't go wrong. Okay. The thing is, and Yadi said last week was an extremely busy week for us, and so I'm sorry that I couldn't get back to you or help you at the time. And again, I wasn't expecting that someone at Evolve wouldn't know where the simulation playground is, but now you do. Got it?
Yeah, I'm like looking at it now because we did do that through like my whole class.
Mm-hmm.
The only issue is it wouldn't let me select the patient from the ones in the assignments. So
no, you don't. These patients that you're using now, you don't get from the assignments. You put them in.
Okay, because that was the only issue. I couldn't get into that software unless I clicked on a patient.
Was this a current issue or was it an issue while you were in class?
This is a current issue because when we would work on sim charts while we were in class, but it would be the patients that were selected right above.
So the difference between the patients that you select, let me open it up. The difference is this, and pay very close attention. The patients that you're entering in your externship, your simulated externship, don't exist in SimChart. So you can't select these patients. You have to create them. Okay?
Okay.
All right? So that's a difference. But this is important. What I'm about to show you is important. Once you get, and let me see if it will actually let me do this. Opening up another incident. Yeah, it will let me do it. So I'm going to X out of here so it doesn't slow the computer up. Once you get into the simulation playground, and this is important, when you click that, I repeat, always, even if it is a new patient, always click return to previous session with saved patient information, even if you've never put anybody in. Doesn't make sense now, but it will, because once you start putting these patients in that don't exist in in what's pre-populated in SimChart, once you start putting your own patients in, what you're going to be doing, you won't be able to find them if you start a new session. They'll be gone. So always click here, okay, and you start, and then you need to start fresh. So for example, you'll have the ability, for those of you who are not new students, you have the ability to actually enter patient demographics here, okay? You have the ability to make appointments, you have ability to do billing and coding, to post charges and payments, and you have the ability in this tab to create a brand new office visit. That makes sense?
Okay. I'll go and look at that later today, because usually like on my end, it just has my name to sign in and it automatically brings me up to the new patient since that they have up there.
We have to, I want to be able to look at your screen. So when we're done here, stay on and I want to see what you have.
Okay.
Okay, so we can straighten this out so you don't have to wait for somebody to help you.
Okay. No worries.
Okay, good. All right, so the only difference in this week and what we've added to this week is that we're actually going to be, in addition to entering basic demographics, you're actually going to create an office visit, a super bill, and claim form. Okay? And if you follow the steps, you should be fine. Now, I've had a request. The other thing that you're going to be doing as your YouTube video, let me circle back for just a minute. Remember, follow the checklist. Okay? If you do everything on the checklist, you'll be fine. And if you have an assignment in every one of these drop boxes on the checklist, your attendance will count. If there's anything that's missing, I can't give you attendance credit. Okay? The other thing of it is that it's really important. Usually you will know within 24 hours of when the assignment is due whether or not it's going to be on time. I need to know whether or not you need more time before the day it's due. That is something I need to know. The other more important thing that most of you have probably discovered by now is don't wait until Wednesday to start your work. You don't have enough time to do it in one day. The course, this session is open now. You can start now, and you can do like a lot of students do, is they just start, they get as much done as they can over the weekend. All right. So with that said, once you have gone through your checklist, everything here, and dropped everything, an assignment in each one of these drop boxes, you're good to go, and you'll get attendance credit. Now, one of the YouTube video this week is going to be on report coding tips. You can easily use this document here that says report coding tips, and there is a link to the online article at the AAPC website that has much more information on it than what I've abstracted, which are some general notes. You can use this document as an outline for you speaking about how to code a report. All right? And although this week we don't have time to go into the details of coding reports, we'll be able to do some of that next week, but because this week what I'd like to do is review steps to accurate diagnostic coding with you. There's been a request. Some of you have not had the opportunity to learn the details about diagnostic coding. So I'd like to ask you, for those of you who have it available, if you can take out your ICD-10 coding book. This won't take long. This is just going to be a very brief exercise just to walk you through what it takes, what you have to think about when you're coding some of these reports. Okay, now, for all intents and purposes, and for those of you who don't have access to an ICD-10 book, but who may have taken the course online, one of the things that I want to point out to you that is a benefit of working in chart for the medical office is that, let me close this because this takes up memory, is that most of you, let me get to the right screen here, take a note here of the True Code. Most of you have access to True Code. It doesn't always let me in for some reason, but most of you have access to True Code. This is where you can actually look up your diagnostic and procedural codes. So while you don't necessarily, as long as you can access True Codes, you don't necessarily need a code book. So this is how True Code looks. When you're coding the reports, you have the ability, by using the drop-down menus, we don't use ICD-9 anymore, so I'm going to simply ignore that it's there. It's outdated. You can code your diagnoses from here. You can look up your diagnoses codes from here. You can look up your external cause codes. You don't really have any of those. You can look up your, not ICD-10 PCSB because we don't code those, but you can look up your CPT codes or procedural codes under the CPT tabular. And you can also look up drugs. You're going to have to use this for this assignment because the first patient that I pulled up actually gets an injection, and we have to build a HCPCS code for that. You'll find it in the HCPCS tabular and the CPT. So these are where you look up your codes if you don't have a diagnostic coding book. So for example, this patient has, the first patient that we're seeing today, or that we're going to enter, has general malaise. All right, I'm going to look up the ICD-10 code for malaise and see what we find. And there you go. See? And this is how you would find the codes in lieu of having in lieu of even knowing how to use your diagnostic coding book. This is where you find them. Okay. Now, to that point, and very quickly, because I want to get you out of here as close to noon as possible. To that point, I'm going to review with you very briefly what the steps are if you are using your diagnostic coding book, the steps to accurate coding. And this document, by the way, is actually posited in your in this session. All right. So the first thing that, how many of you thumbs up if you have an actual diagnostic code book handy. Okay, good. Yay! I can't see Charlene or Lizzie. Okay, Marjorie, I see your virtual thumbs up. Thank you very much. And I see you too, Alicia. So good. All right. So in your diagnostic coding book, which I always have, excuse me, I'm going to be off camera for a minute. This one, the big one. All right. ICD-10 coding book is divided into 2 sections. Who can tell me what those there are more than 2 sections, literally, there really are. But the 2 main sections that you use.
Tabular and alphabetical.
Yes, is that Lizzie?
Yeah.
Thank you. It's the alphabetic index and it's the tabular, right? And so this is what you have to think about when you're looking up codes. Now, the first step in identifying and finding the diagnostic code is to identify the main term in the diagnostic statement. All right? The main term, and I'm going to give you a reference to that in just a minute. The main term can reference a diagnosis. It can reference signs. For example, that patient that we're going to enter this week, she has a sign or a symptom of malaise. It can be a sign, which is an objective, something you can observe, like a rash, okay? It can be a symptom, such as malaise, fatigue. That's a symptom of something, okay? It can be a condition, pregnancy. Pregnancy is not a disease. It can be classified as an admission for example, an admission for the administration of anti-neoplastic drugs, admission. It can be an encounter. An encounter doesn't necessarily mean that somebody's sick. Are any of you familiar with Z codes? Those Z codes that we use? The Z codes are used to identify when a patient has had an encounter with a physician or a professional when they're not necessarily sick. You know, somebody can go to a professional to be screened to see if they have to be screened for prostate, a PSA. That doesn't mean that they have prostate cancer, but they're having their PSA levels checked. A woman can be screened to see if she has the breast cancer gene. Doesn't mean she has breast cancer, so you can't give it to her. So this is when these Z codes come into play. And a complication, an example, this can be a main term, complication, pregnancy complicated by, or complication of a surgery. So these are main terms, okay? So you have to identify what that is in the diagnostic statement. So what I'm going to do is I'm going to scroll down here to this diagnostic statement. This diagnostic statement says abscess chest wall. That's the whole statement. So in this diagnostic statement, I have identified abscess as the main term, and you can see why, right? It is a disease, or it is a sign, okay? All right? Or even a diagnosis. So what I'd like for everybody to do right now is locate the main term abscess in the index of your diagnostic coding book. It's real easy to find. I tried to make it easy, A, B, C. No, A, B, S, really. Okay, so let's find that. And once you find it, I'd like to see a thumbs up so I can make sure we can move along properly. And so what you want to do is when you're looking for this term, abscess, you want to make sure that what you locate is the first instance of that word in your index. Okay? So if you can see my screen here, well, it's too small, so I'm not going to look, but you'll notice that you'll see some terms that actually have the main term, but next to the main term, what it says is continued. And if it says continued next to the main term, that means that you need to go back until you see the very beginning of that main term, the very first occurrence of that main term in the index. And once you find the very first occurrence of that main term in the index, thumbs up. Take your time and find it. I'm going to pause the recording so we don't use recording space. At least I think I'm going to be able to pause. Okay, it's not letting me. I hope it eventually does. Let's see. Okay, got it? Let's move on. You find abscess, and right after abscess, you see some words in parentheses, okay? What those are in the alphabet. Once you locate the main term, refer to the book as the index. So any parenthetical statement next to the main term. These parenthetical statements that you see next to this main term, abscess, that say connective tissue, embolic, fistulous, infective, metastatic, multiple, pernicious, pyogenic, all of those parenthetical statements mean that if you're looking for this type of abscess, you're going to find it here. That's all that means, okay? Sometimes, keep in mind that you can never locate a main term, or anatomic sites are never main term. If you look under heart, it's going to say C condition. If you look under arm, it's going to say C condition. If you look under eye, it's going to say C condition because it's looking for a disease. So once you find the main term and you reference these terms in parentheses to make sure you're in the right spot, then you start reviewing subterms. So in this case, for our main term, because we have abscess of the chest wall, a subterm, one of the subterms is going to be chest. That is an anatomic site. So the next word I want you to look for is chest. And these are in alphabetical order. All right. So you have ankle, artery, abdomen. You have bursa. And then you, under cheek, you find chest. Everybody see that? Thumbs up if you see it. Got it? And then underneath that, okay, this is another indented term. You have wall. Okay? So you have to find all the words possible, either the words or the synonymous terms. You have to find all, this should not be here. Any reference whatsoever up to the highest level of specificity as you can. All right? Once you find the word that you're looking for, so in this case, if we have located abscess, the subterm chest, and then the indented term under chest, wall, okay, what you'll see is a reference to a diagnostic code that is L02.213. Thumbs up if you see that. Okay, once you have that reference, the second thing you do, after you do all of these, refer subterms, cross-references, see also, etc., then you verify the code selected from the index in the tabular. So right now, I'd like everybody to find under the L's, okay, L02.213 in the tabular. Okay. Thumbs up when you find it. And again, this is in alphabetical order and it's under the L's in your book. Okay. Once you find that, and this is something that's really important. Now you see that code L02.2. When you find 213, is it? Yeah, 213. You find the code cutaneous abscess of the chest wall. That's your code. That's the one you're looking for. Okay, but you have to make a note in your mind, and you have to get into the practice of when you actually do locate the code, or you locate where it is, you have to refer to the beginning of the code category for instructors related to this group of codes that you're coding. So the beginning of this code category, okay, not only when you go to the top, very top, categories have 3 characters in them. When you go to the beginning of the code category, it will actually give you special instructions. So for example, the beginning of this category is L00. I'm sorry, L01. Okay? And it defines what it is, etc. Move up a little further. Staphylococcal, additional now. Infections of the skin and subcutaneous tissue. This is actually the beginning of this category. L00 to L08, this category. When you go to the beginning of the category, it gives you special instructions to use an additional code from another category of diagnostic codes to identify the infectious agent. So what this means in this case, in the abscess of a chest wall, is that you have not completely coded this unless you code the abscess and the infectious agent would cause the abscess. That's what this means. So this is just a very abbreviated walkthrough of finding diagnostic codes, okay? And if you're going to be thorough and precise in locating these codes, you have to do it right. And one of the ways of doing it right is remembering as a habit that once you, even if you find the code and you go, aha, yep, cutaneous abscess of the chest wall, that's the same. As that's it, okay? Even if you find the code, you have to get into the habit of going to the beginning of the code category for instructions related to this category. And instructions related to this category, which is infections of the skin and subcutaneous tissue, and it gives you that code range. These instructions involve using an additional code from a different section in the diagnostic tabular to identify what kind of organism has caused this, if it is in the documentation. It's not always in the documentation, but if it is in the documentation, and it's usually staph of some kind, abscesses are caused by staph, okay? Unless they're caused by other different types of abscesses that are related to a malignancy or something else. But this is a good lesson for you, and it's something for you to pay attention to, because in addition to telling you got to use another code, it also tells you some differences in what you can't use. Okay? I know that was quick, but that's it. All right, I tried. It's like 7 minutes after 12. I try not to go over an hour because I know as someone speaking from my own experience, it's real hard to take information in after a certain amount of time, and there's brain starts kicking out, so I'm going to stop here. I'm going to, let's see, move this out of the way and get rid of this and get rid of some of these things I have on the screen. Does anybody have any questions about what we're doing this week? Any questions or concerns?
I had a question. I just wanted to confirm that next Friday we don't have a Zoom call, correct?
Oh, thank you. Thank you for bringing it up. No, you don't. But
Okay.
new students are going to have to, and did you see that on this, did your career services person tell you that?
No, we talked about it last week, but I just wanted to make sure.
Right. So what happens is you actually don't have a Zoom call next week. The new students have to meet me at on Wednesday, but no Zoom call. So pretty much the only thing that needs to be explained is how to post payments. And I won't be able to do that. So what you're going to have to do is you're going to have to use the instructions that are there and go for it. Okay? Any other questions? Anybody have any other questions about anything? Go ahead, Rosario. Your turn.
On my homework, you commented something about the assignment for the internship.
I can't hear you. You said that I commented about something
On the assignment. Those assignment 1, 2, 3.
What did I comment?
It says OSC are the reports, and I don't see you have coded this. Please reference the document entitled report coding on your comment.
We should talk about that privately.
Oh.
Okay. So if you want to, you can stay on. Once I close out today, you can stay on. All right?
Okay.
Okay, good. Okay, unless anybody has any questions, I'm going to go ahead and stop sharing the screen, and I'm going to end here. And have a great Thanksgiving. Have a nice weekend. I'm going to go ahead and, let's see. I'm going to save the chat so I can make sure your name is in the chat. Because this is how I'm documenting your attendance. Everybody have a good weekend. Thank you for joining. And enjoy your Thanksgiving. Bye-bye. And you can stay on, Rosie. You can stay on. Mm-hmm.
So the next Zoom call would be what day?
No, the review on Wednesday is only for new students, so next week we don't have a review.
Okay, cool.
Okay? It's a holiday. All right. Thank you.
So for Wednesday, I have to show up for the Zoom call, right?
You're not new, so you
Oh,
don't
okay.
have to. Yeah.
Got it. And then also, I don't have my laptop on me, so I can't really show you my center point of view.
Okay.
But I can take a picture of it later once I'm off of work, and I can just email it to you
That
as to
sounds
what
good.
I see when I first open it up.
The sooner the better. Now, I'm not
Okay,
going to be
that's fine.
available again until about 2 o'clock. So
That's
anytime
fine.
between 2 and 5, you can, if we can get together, that'll be good. Okay?
That's fine.
Okay.
All right. Thank
Take
you.
care. Okay, I'm glad that we could work something out. I'm sorry you
I
couldn't
know.
get in.
I
now.
was like that. At
Don't-
least cleared up as to what I should have seen,
Right.
rather than what I'm actually seeing on my end. If not,
Right.
it could just be the fact that my software is kind of off. But I'll go ahead and double check that the moment I get home.
Okay, sounds good.
And thank you.
You're welcome. Hi, Alicia. You have any questions? Did you have questions?
For the YouTube video from last week for session 2, I'm having trouble on YouTube loading it. It like loads halfway and then it just gets stuck. So that's the only assignment that I haven't submitted.
So what you do is copy the link and paste it onto a Word document and put the Word document in the Dropbox.
No, well the thing is I can't even get the link because the video's not uploading to YouTube.
I wonder why.
Yeah, I'm not sure because it's just the YouTube. Like I was able to load. Like on Moodle, like I'm able to work it and upload stuff there. And then when I was trying to get my YouTube video from my phone to download it onto the YouTube website, it just like loads halfway and it would just get stuck. So I did just
part of
delete
the problem,
it and try to
part
reload it.
Okay. Okay, do your best, but if you can't, you need to type something on a Word document saying that you had a problem uploading it. But make sure you keep that video because I will have to make sure you did it. Keep it someplace.
Yeah, I still have it on my phone.
Good.
It's just I can't load it to the YouTube website.
Okay, so you keep it on your phone, and I may have to verify that you did it, but you need to put something in that Dropbox to document that you've given attention to that assignment.
Okay, and I'll try again today. See if maybe it works today to upload it. Okay, thank you.
How's your mom? You're the one. How's your mom?
She's back home. They did release her, but she just has to get more testing done and see if they basically her cancer's just progressing, so it's just really hard.
I understand. I actually had a similar issue with my father, so I understand. So I'll send a lot of positive energy your way.
Thank you so much.
Okay, you're welcome.
Thank you. Likewise, thank you.
And how about you, Adriana? You have questions about anything?
Yeah. For session 4, since we don't have a Zoom call next week, will it be available? Because on mine, I don't have session 4 available yet.
You won't have it until next week because we're doing session 3 this week, but I'll make it available.
Okay. Thank you.
You're welcome. Okay, Rosie, what was it? Stephanie, are you there? Did you have some questions? Stephanie T? Okay, I guess she's not there. Rosie, how can I help you?
Yes, for the assignments on those assignment 1 to 3, those evaluation management modes.
Yes.
The other assignments. We commented on all of them on the session 1 that all you see are reports. I don't see that you have coded these.
Right.
This reference looking into.
Do you understand that you're supposed to be recording the reports and putting answers in?
Recording?
You're supposed to be coding the reports. You have to read the reports and determine the codes for the reports and submit those as answers. Okay, so let me show you how to do that. And I understand if this is something that you haven't done. I'm not really sure what's going on with the screen here, but it is Screencast-O-Matic has stopped working, and I don't know because it actually did record.